Michael Gallagher, your board-certified clinical specialist in sports physical therapy, continuing to talk about the knee joint and what we do when we're having knee pain. So we talked a little bit in the past about how we strengthen the joint, how we decrease our inflammation or swelling, but just as important is maintaining our flexibility. Patients with knee pain many times will say, my knee feels stiff. Some of that stiffness may come from fluid around the joint. Much of that stiffness comes from not using the joint, not bending, not flexing the joint. Our hamstrings, our quadriceps, the muscles that cross the knee joint become very tight. So what I'm going to show you today is just a few simple stretches that you can do at home when you're having knee pain. The area that becomes tight usually first is the hamstring. Most people have a tendency of having tightness behind the leg or behind the knee in the hamstring musculature. So what I have here is a stretch out strap. At home, a belt, a towel, an old pair of stockings works just as well. What we do is we place it around the foot and ankle. And we grab with our two hands. And we're going to bring the leg up and pull towards the nose. Now we're going to relax the leg and let the arms do the work, stretching out behind the knee, stretching out the calf at the same time, holding for a count of 15 seconds and doing 5 repetitions. So if you remember, when we did our strengthening, we did sets of 5 seconds, 15 repetitions. Stretching will stretch 3 times longer. We're going to hold for 15 seconds, but only going to do 5 repetitions. A nice, slow, static stretch of the muscle is a much better way to regain flexibility. And down. How does that feel? Okay?
Yep.
And let's bring it up again. And hold. And again, we're going to hold for 15 seconds. All these exercises can be done bilaterally or on both sides. But especially with our stretching, I recommend that we do the right leg and then alternate to the left leg, doing sets of 5, holding for 15 seconds each. Many times when we have an injury, we limp, we start favoring the other side, and our good side, which we'll call it, actually starts to hurt. So we always want to make sure we take care of that as well. So we're just going to switch over to the other side, and we're going to bring the leg up, and we're going to hold. And generally you'll see a difference. You'll feel that your non-injured or non-painful leg is a little bit easier to stretch, and we'll go a little further. With stretching, we never want to force it. We want to go comfortably when we feel a good pull behind the knee and behind the calf. We also want to do a steady stretch, not ballistic, not bouncing 1, 2, 3. When we stretch that way, we actually trigger little receptors in the muscles and the tendons called Golgi tendon organs and muscle spindles, which actually will cause the muscle to tighten even more so. They're the body's protective mechanisms that help us or help to prevent us from tearing the muscles. So again, remember, when we stretch, it's going to be a steady, static stretch, remembering not to bounce. The next muscle we're going to stretch is the quadriceps. The quadriceps is the front of the knee joint. The best way to do this is slide to the end of your bed or the end of your couch. Hanging your leg over the edge, we're going to take our strap or a towel, we're going to place it around our ankle, grabbing with our hand and pulling back towards the table, stretching out the front of the leg, the quadriceps muscle. Again, we're stretching, so we're going to hold for 15 seconds. Not bouncing, a static stretch, and relaxing. And I'm going to jump around to the other side of the table so you can see what it looks like on this side. Again, stretching both sides at all times. So leg hanging over the edge, grabbing the towel, belt, or strap, and pulling straight back, feeling that stretch in the quadricep muscle. 15 seconds, 5 repetitions. Basic stretching for knee pain. We'll see you in a little bit.